All right, so this is part one of the chapter 7 lecture video that we're going into this week. So for chapter 7, it starts off talking about the retail pharmacy facility. So community pharmacy is another term for retail pharmacy. Inside a retail pharmacy, you have two areas. So you have the front area, which contains OTC drugs or over-the-counter drugs, dietary supplements, medical supplies, and then you have your back area, which is behind the counter, and that's where we store all of the prescription medications and prepare prescription medications. So for a community pharmacy or a retail pharmacy, the focus is on service and convenience. So service is the automation. It says filling and generating and filling prescriptions for patients. The convenience is many of these stores offer extended hours. Some are 24 hours a day. Some of them offer drive-through pickups for their prescriptions, and then some actually offer home deliveries. So your role as a pharmacy technician in a retail setting on slide 8 is there's a lot of different roles and responsibilities. You're the front line of customer service. So you're greeting the patients, you're answering the telephones, you're initiating refill requests because we're allowed to do that. We can take refill requests from patients over the phone. Clarifying prescription questions, updating the patient profile. Every time they come in, we're making sure that their address, phone number, everything on their profile is up to date. Entering and updating their billing information, okay? Insurance information, entering new prescriptions, submitting your online claims, which is online adjudication, is what we call it when we submit those claims for the prescription to the insurance company through online. We resolve eligibility and processing issues with insurance companies. So typically pharmacy technicians are doing the insurance stuff. Pharmacists don't like to deal with it. They are more clinical, so they should not be dealing with all of the insurance issues. So as you start working in a retail setting, you're going to become a very fast learning insurance guru over time. You're going to count, you're going to restock, you're going to reconstitute, you're going to package medications, you're going to affix the medication labels to the containers, you're going to retrieve the products from drug storage, return stock bottles to their proper locations, distribute labeled and verified medications to the patient at the pickup process, store completed prescriptions. So you've processed everything, you filled it, they're not coming in to pick it up for the day. You properly store it in the right area. When the patient comes to pick it up, you're retrieving the right prescription for the right patient. You're offering counseling for the patient from the pharmacist, and then you're ultimately accepting their form of payment. So it's important to understand that the role of the pharmacy technician varies from state to state. So there is not a federal law or regulation regarding pharmacy technicians and whether they need to be certified and licensed or any of that. It's different from state to state. So what the requirements are for a pharmacy technician to practice in Arizona is completely different from other states. Technicians should always refer clinical questions to the pharmacist. We are not clinical. That is out of our scope of practice. Some technicians also compound medications. That's true. The Walgreens here in town on Jessica and Broadway, they do a little bit more compounding, but we do have a few mom and pop compounding pharmacies here in town that's all they do strictly is compounding. Now, in the state of Arizona, if compounding is something that is interesting to you and interests you, you must be certified in order to work in a compounding pharmacy. They do not allow trainees. As a technician, you must juggle multiple tasks at once, answering the phone, working the drive-through, working the counter, filling prescriptions. So you have to be able to multitask. Your prescription processing. So it's a complex procedure that must be both efficient and accurate. It requires teamwork and communication, not only from the pharmacy technician, but also with the pharmacist. This process begins when you receive a new prescription, either from the patient bringing it in to you or it was sent over electronically, or if it was sent over by fax machine. And the ending point is when you dispense the final product to the patient. There are additional steps required for certain prescriptions, such as controlled substances, any drugs that are high-cost drugs that require a PA or a prior authorization from the insurance company, and then the drugs that have REMS programs associated with them. So your path of a new prescription, this is from slides 11 to 13. I'm not going to go through that because you have an assignment that requires you to do that. So we are now on slide 14. So this is what a complete prescription looks like in the photo. So you are required to verify every prescription that is brought into you that it is accurate and complete. It has to have the prescriber's information. It must have an actual date that the prescription is written. It must have patient information on there. It must have the drug name, quantity, and strength. It must have the directions for use, and then the signature of the prescriber. So the prescriber information that's required: the prescriber's contact information, the NPI number, which is used to bill insurance or submit insurance claims, that must be there. And then the prescriber's DEA number if the prescription is for a controlled substance. Your patient info, the patient's contact information, phone number, address, their date of birth, their gender. So date of birth is one of the most important components of the information that we gather from our patients. And the reason for that is it helps the pharmacist to verify that the dose that's been ordered is appropriate for that patient and their age. Also, when you think about patients and familial units, sometimes in homes there are multi-generations, and some of these generations have the same name. You know, Bob Smith Jr., Bob Smith Sr. The date of birth is what's going to identify those specifically of which patient you're dealing with. And sometimes you're just going to have patients with the same name that have no connection at all. So in addition to verifying their phone number and address, you're going to make sure that you're identifying their date of birth. Gender is huge as well, for many different reasons. One, we want to make sure that in the event that the patient has a name that is kind of gender, can be a boy name or a girl name, that we know and we're identifying the correct gender of the patient. But also too, we have transgender patients. We have patients that identify as other genders, but they still physically have their assigned at birth body parts. And the reason why that's important is because a medication in a woman sometimes is absorbed and done differently than in a male's body. So we want to make sure that the anatomy wise, we know what that gender is. We still want to respect their gender identity, call them and refer them to the name that they prefer, but also have that information to ensure that the medication that they're getting is safe. So tips on your reviewing your prescription: if the patient's name is illegible, you can write it in legible handwriting on top of the prescription. That is fine. It's helpful to have more than one phone number. Not every patient is going to be willing to give you more than one phone number. A lot of people don't have home phone numbers anymore. It's just cell phones. The birth date is absolutely necessary for not only the billing, but also the identification and overall minimizing medication errors. If there is any doubt about the authenticity or completeness of a prescription, you are to bring it to your pharmacist's attention immediately. So your function is of pharmacy software. So pharmacy software is designed to transmit e-prescriptions, which is what happens if you go into the emergency room or if you go to the doctor's office and they ask you, what is your pharmacy of choice? You let them know, I use the Fry's at 22nd and Alvernon. They look up that address. So instead of giving you a handwritten prescription, they're sending one electronically over to the pharmacy. Those are e-prescriptions. If a patient brings in a handwritten prescription, we have scanners. We scan the original copy into the pharmacy system so we can see later on, if there's a question, what was actually written. These software these pharmacy softwares are used to maintain patient profiles. They generate warnings about potential drug interactions or drug allergies. They help with managing inventory, and then it's also a connected system to allow you to submit insurance claims. Your pharmacy software facilitates the communication between the pharmacy, the prescribers, and the insurance companies. These systems can also interface with electronic health records, which gives access to medical information databases. So let's think about a system like Elrio. That is a contained system where you don't not only have access to the pharmacy side of things, but also the doctor side of things. All of their charts are connected, and every Elrio clinic and pharmacy has access to those. Some systems interface with barcode scanning technology, which means we would scan the barcode on the bottle that would pop up and match the NDC number of that drug. Computer availability for technicians affects the workload and efficiency. So if you're a very busy pharmacy and you have 10 technicians and 2 computers, it's not going to be very efficient, right? So on slide 19, it actually shows you the flow of e-prescriptions, and you can see how that flows from when it is originally sent in from the patient visiting the doctor, gets to the pharmacy, the process all the way through until it ends up to the patient's hands. So e-prescriptions, again, are electronically transmitted prescriptions. So these actually make up nearly 70% of prescriptions now, which has increased both the speed and accuracy of prescribing. So think about this. They're typing in physically a prescription. So it's kind of taken the guesswork out of being able to read some of these physician handwritings. And let me tell you, they stink. Most physicians write terribly, and it's very hard to be able to read and see exactly what they're asking for. So that's one of the reasons why e-prescriptions was brought into effect, was because there were so many errors being made on translation of prescriptions because of illegible handwriting. It decreases the risk of medication errors, again, due to illegible handwriting. Controlled substances may be prescribed electronically, but both the prescriber and the receiving pharmacy, meaning the pharmacy they are sending the prescription to, must use an approved controlled substance identity authentication and protection software program. If the pharmacy they're sending it to and the physician do not have matching software, it cannot be sent electronically. It must be a handwritten prescription. So your written prescriptions are a paper or hard copy that typically have pre-printed prescriber information, meaning they have that little header on the top that says Dr. Smith and his address and his phone number. Those types of prescriptions are handed to their patient. So it's a handwritten prescription handed to the patient. The patient brings in the prescription and drops it off at the pharmacy. Again, if anything is unclear, you want to check with your pharmacist first. If they're able to translate it or decipher what it says, then it can get filled. If they are not, then the contact to the physician office needs to happen. Tamper-resistant prescription pads, or TRPP. These are a particular pad that are required for all Medicaid prescriptions to be written on, okay? So if you have a Medicaid patient, or access as we call it in Arizona, if they are getting a handwritten prescription, it must be on a tamper-resistant prescription pad. Written copies are usually, again, scanned into the system, which is added to that particular patient's profile. Sorry about that. So last piece here, we're going to go ahead and stop at after this. So we should be at slide 24. So telephone and fax orders. So your telephone orders must generally be transcribed onto a written prescription, and that's by the pharmacist. So if you answer the phone and you have a physician that says, "Hi, this is Dr. Carol Smith. I'm calling in a prescription for a patient." In the state of Arizona, pharmacy technicians cannot take new prescriptions over the phone. You must transfer that phone call to the pharmacist. Anything that's faxed are entered into the patient's profile, so you can pull orders off the fax machine and put them in, but everything that you put in, every prescription that you put in, the order entry process is going to be verified by the pharmacist before any of the filling process can take place. Schedule 2 prescriptions, so meaning any drug that is classified as a controlled substance C2, so Demerol, morphine, Oxycontin, Percocet, Vicodin, all of those, morphine, those are C2 drugs, Schedule 2 drugs. Those prescriptions cannot be faxed, except for 2 exceptions: hospice and long-term care facilities. Those are the only 2 exceptions that we can receive fax prescriptions for C2 drugs. And we're going to go ahead and pause there. If you have any questions, please reach out.